This is an aspirating syringe. This is for giving injections into patients' mouths. This is a carpule of anesthetic. This has a rubber plunger on one end, and then the gold part is where the needle goes in. Has the information about what's inside of it, whether or not it has epinephrine or any kind of vasoconstrictor in it. This is our 2x2 gauze for wiping the patient's oral mucosa before we place our topical anesthetic. This is a jar. Never stick anything dirty in here. Always only stick clean cotton tip applicators into there. These are cotton tip applicators. They're used for applying topical anesthetic in a patient's mouth. For needles, we have the long needle. Okay, you can't really go by the color because the color depends on the brand. You have to look inside of it or look to see the length of it. The long needle is for lower injections. IA blocks means inferior alveolar nerve blocks. This goes on the lower right or left of the mouth. This is the PDL needle. Okay, that's to go into the periodontal ligament of each individual tooth. This is called the short needle. This is for palatal injections, mandibular foramen blocks, mental blocks, and infiltration on the buccal vestibule of the maxillary teeth. This is a high-speed handpiece. This is for cutting and prepping teeth and for, what am I trying to say? And for trimming restorations. This gets a friction grip burr. This is a friction grip slow speed handpiece. It has the small hole in the end because it is meant to get friction grip type burrs. All right, you'll see that the friction grip type burr has a smaller shank to fit into the friction grip slow speed handpiece. This is for polishing restorations and trimming restorations as well. This is the latch type slow speed handpiece. You'll see that it has a bigger hole compared to the friction grip handpiece. Kind of hard to see. This one has the bigger hole. This is to fit latch type burrs. All right, you'll see that this burr has a little tiny latch on the end. Fits here into the handpiece, and this is for also polishing restorations, for removing decay, and for removing some kind of other soft materials such as temporary fillings and whatnot. Next we have our basic setup. This would be in any of your setups such as amalgam or composite. This would also be for any exams. You'll pretty much have this in every single appointment that you do. So first we have the mouth mirror. Okay, the dentist gets this passed into their left hand right at the beginning of every single appointment. This is the Explorer and Perio probe. This end, this hook is called a Shepherd's Hook Explorer. This is the Perio probe. This is for finding cavities in patients' teeth. This is for checking for gum disease, the Perio probe is. Then we have the bite stick or tooth sleuth, all right? The bite stick is for checking for cracks in patients' teeth. They bite hard on it and it'll hurt if they have a crack. These are the cotton pliers. These, as you can guess, are for putting cotton in and out of the patient's mouth, for grabbing small things in and out of the patient's mouth. They have lots of uses. They can also be used as an extra clean tool to set aside to grab other clean things that you might have, such as anesthetics, carpules of anesthetic, and carpules of composite, because we don't want to get those dirty. We want to keep them off to the side and get them with a clean instrument. This is the air-water tip. This goes into the air-water syringe and shoots air and water out of it for limited rinses and rinsing and drying for the doctor.